The following segment is sponsored by Northern Nevada Health System.
We're here with Heidi Simon with Northern Nevada Medical Center, who's an occupational therapist, but also a certified lymphedema therapist. Hi.
Hi.
A lot of questions about lipedema and lymphedema. First of all, what is lipedema?
Lipedema is a swelling condition. It is a swelling and fibrosis condition that affects subcutaneous adipose tissue, which is essentially fat tissue inside the body. And a big distinction that I like to make about lipedema is that it is a disease of fat tissues. It is not simply obesity. They're very different things.
Got it. So what is the risk of developing lipedema, and what causes lipedema?
Lipedema is predominantly about 40 to 60% of the time a hereditary condition. However, the other remaining times it's just something that you happen to be born with, although that doesn't mean that it presents as soon as you are born.
At what point in someone's life would it be diagnosed?
It would be diagnosed, usually presents itself when someone is going through a hormonal change. So that varies from puberty to menopause to giving birth to a baby, being pregnant.
Okay, so we mentioned you're a certified lymphedema therapist. What's the difference between lipedema and lymphedema?
So lipedema is I like to call it a contained swelling. So it affects adipose tissue, and it is a swelling within that adipose tissue. Lymphedema is a swelling related to the lymphatic system. It's a protein-rich fluid, and it can either be inside of a cell or in the space around the cell.
Interesting. And so how do you treat lipedema?
It is treated actually very similarly to lymphedema. You're going to traditionally or conservatively want to go through a complete decongestive therapy that has 4 components to it: manual lymphatic drainage, compression, exercise, and then making sure you're taking care of your skin and your nails. It does vary from a traditional lymphedema therapy treatment. Because lipedema affects or creates fibrotic tissue, you have to use soft tissue mobilizations. You have to break up that fibrotic tissue and get it moving, get it back into the lymphatic system so that you can help decrease the swelling in that part of the body.
All right, a lot to go through there, and
Yes.
we've put a lot of the facts on our website. Just go to foxreno.com. Heidi, thanks so much.
You're welcome.
Appreciate your time.